So the big question I'm often asked is, can you prevent arthritis? Well, first of all, you need to understand that arthritis is not a single condition. Osteoarthritis is the wear and tear that we all get as we get older. It often affects the hands, the hips and the knees most, but can affect pretty much every joint in the body. Now, osteoarthritis is not really a preventable condition, but there are certain things which are important to be aware of. For example, there's no evidence that regular exercise will cause osteoarthritis, but certain intense exercise certainly can. And so if you're running regularly on pavements, for example, you might be better off running on softer surfaces and making sure you've got adequate suspension. Equally, people who are using pneumatic drills can develop arthritis. So there are certain high stress activities which can be occupational or can be sport related, which can lead to arthritis. If you're doing repetitive actions with strain, with load, then it is possible that that can cause the body damage over time. And so that's really got to be thought about. The other type of arthritis is inflammatory arthritis. That's a whole umbrella of conditions where the immune system is attacking the body. In order to reduce, not prevent, but reduce the risk of these conditions, it's important, first of all, not to smoke. Second of all, it's interesting that being overweight can be associated with some of these conditions. It's also associated with osteoarthritis of the knees in particular. Thirdly, there is a link, and this is not fully understood yet, but there's a link between bacteria within the mouth and certain types of autoimmune arthritis. And so keeping good dental hygiene may be an important part of reducing the risk of autoimmune disease. Finally, though, there is a genetic component here. It can run in families, and of course there's nothing we can do about our genes. This is still a very active area of medicine. We're interested very much in the microbiome, in the effects of different bacteria within our gut on the immune system, and we know that there are interactions between food, the microbiome and arthritis. Many patients ask me about diet, and is there any clever exclusion or specific type of diet, a gluten exclusion or inflammatory diet. The truth is, scientifically, that we're not quite there yet. At the moment, we recommend for patients with arthritis or patients trying to avoid arthritis a general healthy balanced diet. And a lot of the fad diets that are out there have really very little evidence behind them.